Welcome, everyone. Thank you so much for joining today. I'm Jenny Miller. I'm the Executive Director of the Global Climate and Health Alliance. Very happy to have you all here with us today for Energy, Methane, and Health, Reducing Exposures Now and on the Road to a Clean Energy Future. This is going to be a short 30-minute briefing where we'll get to hear from a handful of speakers speaking to different aspects of this issue. And hopefully inspire you to think more about these intersections and think about how you might want to be involved in working on these issues. We have interpretation. Could folks please mute yourself? Karma Wangdi, could you please mute yourself? Milena, are you able to mute them?
Yes.
Thank you. If folks could, this is a meeting, so if folks could keep yourselves on mute when you're if you're not a speaker, that would be great. We have interpretation, so if you would like into Spanish available, if you would like to use interpretation, please click on the globe at the bottom of your screen and select the language. Okay, we invite you. So we're not going to have a dedicated Q&A period. However, if you would like to ask questions, please feel free to post them in the chat as we go along, and we'll ask our speakers to, when they're not speaking, to kind of keep an eye on the chat and respond to questions that come up. I also invite everyone to introduce yourselves in the chat, including your name, your organization, and where you are based geographically. And without further ado, I would now like to turn over to Amanda Quintano of APT Associates. APT Associates partnered with GCHA to develop a series of reports on methane mitigation and the potential benefits for health of methane mitigation strategies. So to tell us a bit more about that in the energy sector, I'll turn over to Amanda.
Thanks, Jenny. Can you see my screen? Great. So I'm Amanda Quintana. I'm with APT Associates, and as Jenny mentioned, we developed these reports with GCHA on mitigating methane, methane and health series. And so today I'll discuss the fossil fuel sector report in more depth. I'll discuss a bit more about the methane and health linkages, as well as methane reduction strategies in the fossil fuel sector. So firstly, oil and gas activities contribute roughly to about 23% of emissions, which we've covered in the report. Methane is released as a result of leakages, venting and flaring, and incomplete combustion during flaring or end use. There's also 12% of emissions coming from the coal mining industry, and methane is released through seepages from exposed coal seams, ventilation and drainage processes, post-mining activities, and abandoned mines. Some of the methane and health linkages that we covered in our report is that methane released from fossil fuel activities contributes to tropospheric ozone, which is tropospheric ozone exposure, which is linked to asthma, respiratory illnesses, cardiovascular diseases, and premature death. A study from PSC Healthy Energy in 2021 found that methane is almost always emitted with other hazardous co-pollutants, such as non-methane volatile organic compounds, which can cause cancer. Methane is also highly flammable and explosive and can lead to fatal injuries. In the United States, for example, the 2022 Global Methane Assessment found that fossil fuel pipelines have resulted in more than 5,500 accidents, 800 fires, 300 explosions, 600 injuries, and 125 fatalities from January 2010 until November 2018. One case that we highlighted in this report was focused on the health impacts of a natural gas flaring in Iraq. The case in point tells us that a study from Ali Hussein Jaloud, who died on April 2023 as a result of leukemia linked to natural gas flaring. Ali grew up in a near a natural gas production site where natural gas flaring was routine. And this case shows and highlights the urgency to ban natural gas flaring to not only cut methane, but also to protect health. Technical solutions to reduce methane may include replacing old or leaky equipment with zero leakage ones, or installing devices that capture and use gas buildup in storage tanks that would otherwise be vented or flared. Ultimately, the complete phase out of methane emitting fossil fuels must occur to avoid all irreversible impacts of fossil fuels on human health. Lastly, the report sets a way forward that we've divided up between the national, international, and local levels. And here are some of those ways forward that we have highlighted in the report. At the local level, it's imperative that we build public support through the media, informing patients and the public about the impacts of methane and encouraging behavioral changes, as well as supporting and advocating for initiatives to phase out gas heating and cook stoves. At the national level, it's important to prioritize methane reduction solutions in facilities, especially those located near population centers, and end fossil fuel subsidies for new oil and natural gas and coal exploration, and that redirect these finances or funding to clean energy transition projects instead. And internationally, we need to include and highlight the health co-benefits of fossil fuel methane reduction strategies in our NDCs, as well as national methane action plans, as well as advocate for incentives in low middle income countries to electrify or use clean energy sources for power generation, transport, and other end users. That's a bit about the report that I'd like to share today, and look forward to your questions.
Thanks so much, Amanda. So if you have questions about the report, feel free to put them in the chat. The link to where you can access that report and the others in the series is also now in the chat. And to keep us moving, I'm now going to turn to Veronica Sutherland of the Environmental Defense Fund to talk about methane mitigation and health in the energy sector from EDF's perspective. Over to you, Veronica. You're on mute. We can see your slides, but you're on mute.
Still happens in 2023, right? Thanks so much, Jenny, for the introduction, and Amanda for the background, getting us started on health. My name is Veronica Sutherland, and I am a scientist with the Environmental Defense Fund's Global Clean Air Program. So I want to talk today about addressing the drivers of climate change and how we can really move methane action to create public health opportunities to mitigate the public health benefits of methane mitigation. So as Amanda touched on, the oil and gas sector is really among the largest sources of methane emissions worldwide, and it presents an immediate path to slowing the rate of climate change. It's also a significant contributor to local and regional air pollution, as Amanda mentioned. Globally, air pollution is estimated to cause between 3 to 7 million deaths. Just to give you some context, that's more than the impacts of malaria and tuberculosis combined. Air quality impacts from the oil and gas sector are really quite large, and many policies that affect emissions from methane from the oil and gas production may also affect the emissions of these air pollutants and their consequent health impacts. So EDF invested in a study along that we conducted along with the University of North Carolina and Boston University, basically to quantify the health impacts of these air quality emissions from methane emitting activities. And we found that just within the United States, the contribution of the oil and gas sector to adverse health impacts is really quite large, accounting for 410,000 asthma exacerbations, 7,500 excess deaths, and 2,200 new cases of child asthma, which cumulatively cost the US over $77 billion in health damages each year. What was really interesting is that of these, the largest impacts were attributable to nitrogen dioxide exposure, which is released in the oil and gas sector through things like pneumatic devices or the burning off of methane. And the total health impacts of climate change for that were 88 billion. The reason EDF is so focused on the oil and gas sector is because right now there are steps that the oil and gas sector can take that would reduce the majority of these health outcomes. So for a subsequent study, we focused on flaring and venting. and we found that prevention of flaring and flaring and venting would avoid 73,000 of the asthma exacerbations that we found in the oil and gas sector. It accounted for about 10% of the total air quality health impacts and amounted to about 7 billion in air pollution health damages. So traditionally, methane policies have focused on the social cost of carbon, but that does not include the health impacts of air pollutant formation due to methane emissions. The air quality health impacts are sizable in comparison to the social cost of carbon, so it's really worth doing both of these calculations together. Assessment of the impacts of oil and gas production or policies that affect all emissions but use only the social cost of methane may actually underestimate the benefits of reduced emissions by a factor of 10. So EDF's work really shows the importance of including health impacts of oil and gas. Not all air quality impacts from the oil and gas sector can be impacted by methane alone. We really need air quality policies that realize both of these benefits. So EDF is really investing in conducting health impact assessments that incorporate both climate and health. And with that, I will hand it back to you, Jenny. Thank you.
Thanks so much, Veronica. So that the connections are clear and really growing stronger. And I think the methane dimension has been under-recognized, but I think making those links and tying it all together is really important. Okay, I'm now going to turn over to Kim Perrotta of the Canadian Association for Sustainability and Equity to talk about some on-the-ground work in the public health sector that can actually implement some changes to address some of these issues. So without further ado, Kim, over to you.
Thanks, Jenny. Can you hear me okay? Yes? Okay.
Yep, hear you great, and your slides are great.
Great, thanks. For the last 2 years, I've been collecting case studies from public health agencies across Canada, just trying to see where their work on population health and health equity overlapped with climate solutions. Whoops, it's not changing, so just a second. Page down, nope. Sorry, folks, just having troubles changing my slide here. There we go. So one of the climate solutions that we were focused on was green buildings and building retrofits, because that is actually an area where there can be substantial reductions in greenhouse gases in Canada. And I'm going to see again if I'm having troubles here. There we go. So with greenhouse gases in Canada, one of the big ways to reduce greenhouse gases is by insulating our homes and making certain using passive technologies. But one of them in Canada is just switching from our conventional heating systems, which are often based on natural gas, sometimes on oil, over to heat pumps. It used to be that heat pumps weren't all that great for very cold temperatures and had to be combined with an existing heat system, but that's not the case anymore. And we have decided that it's been concluded that we could reduce energy use from conventional home heating by 70% by just switching over to heat pumps. So 2 examples that we have. One is Ottawa. The public health agency in Ottawa actually put 2 of their staff in with the planning department for 2 years to work on a new official plan for the city. So the official plan is where you set all the rules and criteria that will guide development in the coming decades. And so what they decided in Ottawa, they found that 45% of the greenhouse gases there were coming from existing buildings. So they decided that reducing emissions from future buildings was really important. And so they developed a high performance development standard, and public health was directly involved in this process over a few years. And what they found is that they could actually make substantial reductions in greenhouse gases over the next 30 years by ensuring that all new buildings were built to a higher efficiency standard. And then with Island Health is on the west coast of Canada. And here we have a public health agency that's actually an agency of the province, but they have organizations, regional health authorities that are working with their communities in different areas. Island Health is one that works with a lot of small and remote communities. And they set up a healthy built environment portfolio where they could really address population health and health equity. And they worked with community health networks to have kind of a collective impact. In one particular community, they had a real problem with air pollution because a lot of the people in that area were using wood stoves to heat their homes. And so over the years, they worked with this community, and public health brought forward evidence about high levels of fine particulate matter and childhood asthma that helped make the case for some funding from the province to help support swapping out wood stoves. Originally, it was just to natural gas and to more efficient wood stoves, but over time, they've now working to really promote the use of heat pumps in that region. And just a note that green buildings and building retrofits can actually directly improve health by stabilizing temperatures, because heat pumps can actually address heat and cold. They can cool a house as well as heating a home, that we can actually stabilize temperatures and save lives during extreme heat events. But we can also improve health by reducing mold and dampness, and we can also reduce energy poverty because we can reduce the energy costs associated with heating one's home. That's it.
Thanks so much, Kim. Really great to hear about those kind of public health interventions that are making a difference. Okay, our fourth speaker the task of reducing methane mitigation is both one of strategies, as Veronica mentioned, to reduce leakage and emissions from fossil fuel processes today, but also to think about how we continue the transition to a clean energy future. And to talk a bit more about that in the African context, we get to hear from Dean Bebe Bekumuzi of Don't Gas Africa. So Dean, over to you.
Hello, thank you for inviting me to this space. Apologies, I have been away on leave and it's my first day back, so I don't have slides for everyone. But happy to share some insights. As mentioned, my name is Dean from Don't Gas Africa, and I'm one of the co-conveners. So we are trying to map out and build a case for renewable energy, in this instance, clean energy, against building a business case that looks to push back on fossil fuels. So this is really off the backdrop that we are in Africa, being a frontline victim of climate change, a crisis predominantly precipitated by fossil fuel combustion, amplifying such production and usage, rather in this instance contradicts the continent's best interests, and the result of the emissions surge will in a way exacerbate climate challenges and amplifying the vulnerabilities of different African communities. So we've been collecting data across different spaces in Africa. For example, as previously mentioned, around air pollution. In Africa, since I think 2021, when the study was conducted, 712,000 people have actually been killed as a result of air pollution, as a result of fossil fuel dependency. That's actually more than actually unsafe water, which is pegging at 542,000 people a year, with malnutrition at 275,000 people a year, and also unsafe sanitation at 391,000 people a year. So we do have air pollution coming out as one of the key instances that kills a lot of Africans in a given year, which is pegged, as mentioned, at 712,000. Now, even if we look at the data that was presented by the World Health Organization in 2020, the cost of air pollution globally is caused by fossil fuels is estimated at $8 billion a day, or which is roughly about 3.3% of the entire world's economic output. Looking a bit closer to the instance, for example, in Nigeria, in the Niger Delta, where we do have about 16.5 million tons of carbon dioxide being emitted, the life expectancy in that area is 41 years old, right? Quite shocking. So basically, if you're 50 in the Niger Delta, it's absolutely a miracle. And this is all elements that's really been operationalized by the recent Dash for Gas across Africa. One aspect that we've also wanted to explore, and we've been trying to unpack it, is the issue around mental health. In this instance, in provinces in South Africa, particularly in Mpumalanga, where there's a lot of coal mining, a lot of the women have faced a lot of trauma historically because they cannot give birth because of, number one, the air pollution. And if it's not air pollution, it is actually the water that's contaminated, making them barren and not being able to bear children, which has contributed significantly to mental breakdowns across that province, which is Mpumalanga in South Africa. Another aspect that I also wanted to touch on is the notion around water. In comparison to renewable energy, fossil fuels, if you want to produce electricity using fossil fuels, you are taking a significant amount of water, which is quite important in this discussion, given that Africa as a continent is a water-stressed continent. And that is also pegged down to mental health to a large extent, because in provinces where there's actually no water as a result of fossil fuel extraction, most women are being abused by their spouses, particularly for their failure to produce crops. So it's not really a logic reason that, oh, there's a water crisis, that's why the crops are not growing. Women have been targeted and are told instances that, they're not doing enough work to produce food, but it's really tied down to water scarcity, which is being exacerbated by fossil fuels in that context. So there's quite a lot that we've been trying to unpack, given the year that has passed, and we're really trying to link the dash for gas particularly, and also other fossil fuels, which is quite important to health instances. I think one thing that I also want to leave back with is one of the major reasons why we're pushing for renewable energy is currently there is a lack of, I think, about 1 billion people in Africa who don't have clean cooking alternatives. Now, based on that, there's a strong number of women who actually die earlier because of spinal injuries, because of a lack of clean cooking alternatives. Their everyday experience, they would have to bend, throughout the day in order to access, clean cooking alternatives. And given the trajectory, of doing that every day for at least 20 years, you are subject to a lot of spinal injuries. And we saw a spike with that in Central Africa, East Africa, and also Sub-Saharan Africa. I will end there. Thank you very much.
Thank you so much. So many times in dialogue about, the energy access to energy is sort of pitted as something that is access to energy is essential, but many times this is the need for people's health to have access to energy, and for people's economic well-being, their livelihoods, is used to justify expansion of fossil fuels. And it's really clear that we have to look at the whole picture and what the trade-offs are there for health. Okay, at this point, we'd like to get some thoughts from all of you who have joined us today. We have a poll that Milena will pull up. It's only in English, but I hope our translators will be able to translate it. So the question is, these are some of the strategies. These aren't all of the strategies, but here are some of the strategies the health community can use to reduce methane emissions from the energy sector and benefit people's. Which do you see as the most promising for health and public health professionals and the health community to get involved? It's multiple choice. You can choose more than one. But what among these strategies, what do you think are the most promising points for the health community to engage? And I'll just read through the options. Shift healthcare facilities to clean renewable energy. Inform patients about the risks of exposures to ozone air pollution and toxic co-pollutants and how to reduce their risks. Speak to media about these issues to inform the public and decision makers. Advocate for phasing out gas heating and cook stoves. Work on building retrofits and green building initiatives. Advocate for policies to reduce methane leakage and flaring at oil and gas facilities, especially near communities. Advocate against expansion of coal, oil, and gas production and a transition to clean energy. And push for one's country to include methane mitigation and its health benefits in national commitments, like its nationally determined contribution under the Paris Agreement. So we'll give people a couple of minutes to look at all of these and pick the ones that you see as the most promising. And we will have time after the poll to take a couple of questions, maybe just one or possibly two. So if you have a question in mind, you could go ahead and raise your hand, and I'll turn to you momentarily after Milena shares the results of the poll. Okay, so it looks like the strongest option, or the most promising options, seem to be advocate against expansion of coal, oil, and gas production and transition to clean energy, as well as speaking to media about these issues. Following close behind that, we have push for inclusion of these issues in national commitments. But there's also strong support for working to shift healthcare facilities to clean energy, informing patients, working on building retrofits, some advocacy for phasing out gas heating and cook stoves. So it looks like you see potential in all of these strategies, and particularly strong importance to push for the clean energy transition, and speaking to media to accomplish some of these changes. Okay, with that, I'm going to take one question, and depending, probably we just have time for one. So would anybody like to ask a question? In the absence of a question, I'm going to just turn to each of our speakers for one last word, like one final sentence to wrap us up. Let's start with Amanda. Amanda may have. Okay, I see Veronica. Let's have you come in. Final words.
Thanks, Jenny. Yeah, I think that poll is really interesting and kind of speaks to the fact that we have a really big opportunity with methane to both reduce climate change and promote better public health policies. So thanks for having me on.
Thanks.
Sorry, Jenny, I thought we were asking questions live, but yeah, I'll second Veronica's last words. And I also just want to mention that we will have a session at the WHO Pavilion that will address a lot of these conversations that we're having in the separate sector-specific briefings. So please tune into that pavilion session, and we'll make sure to send it out through our channels.
Thanks, Amanda. Kim, final thoughts.
I will just say that we have experienced across our country where when we talk about the health benefits of climate solutions, that we can really bring the public on side, and we can really bring decision makers on side. So just not to underestimate the impact that we as health professionals can have.
And Dean, you get the closing final word. Last thought from you.
Thank you so much. I think the impacts of the fossil fuel energy generation have severe consequences on water quality. One drop of oil can contaminate 25 liters of water and make it non-potable. To produce 1 megawatt of electricity, wind power uses 1 liter of water, solar power uses 15, while coal uses 1,476 liters. Thanks.
Okay, well, thank you to all of our speakers. Really appreciate your joining us and sharing your different perspectives. Thank you to everyone who joined the session today. I hope this small, short briefing adds a little interest and information to your day. And I hope all of you are inspired to kind of work more deeply on this issue. Thank you. And we have 2 more of these briefings coming up, another one in 1 week, and then the final one a week after that. Next week's focuses on the food sector, methane mitigation and health, and the food sector. And then the third one will take a look at methane mitigation in the waste sector. Thank you all for joining us and have a great rest of your day.